Uganda has had a very difficult past, wars, and that has affected the economy, and because of the economic troubles, the health services have also not been spared. The medical services are still very underdeveloped, and there is lack of specialized care and lack of ideal facilities to practice medicine. We need to have private care as much as you want to have state-provided health care. You need quality care, which the government can't afford to provide to people free of charge.
We've got 23 million people, but only quite a small sector of a sort of salaried middle-income group that can afford the services. Like we have the situation in the north at the minute, which is just desperate, then everybody should be getting in there and giving a free medical service to those people and saving their lives. The International Air Ambulance and International Hospital really set out to expand and improve the range of medical services and facilities that are available in Uganda. It started about 7 or 8 years ago with one clinic. About 4 years ago, we started the first international hospital, which had 30 beds. Then we started International Air Ambulance. We opened other clinics. We opened some clinics up country to serve some factories. We opened a clinic in Jinja. We opened a dental service as our patients grew. As we generated some money from that whole organisation, then saw that we could reinvest that and then build a bigger hospital, a purpose-built, state-of-the-art hospital.
Behind us we have a building the rest of the hospital, and included in that is Hope Ward, which will be a charity ward to treat people who otherwise wouldn't be able to pay for our services.
The patients who are going to benefit most from the Hope Ward are a vulnerable section of our population. People who are afflicted by conditions like cancers, HIV/AIDS, war victims, road traffic accidents, and a section that can't fend for itself.
What we want this to be is something that we can offer our facilities, such as intensive care unit, the theatres, the nursing care and so on, to help such people. It's not just a ward just to help the poor, okay? I mean, there's so many poor, how would we decide which ones we can help? So basically it'll be the cases that would really need our help, the cases that would really need the specialised facilities. Victims of the war in the north. We know of these cases where they require reconstructive surgery or plastic surgery. People who've had their lips cut off, had their noses cut off or their ears cut off. People who've been injured by bullet wounds and they need orthopedic surgery.
You have acid burns, they have their faces deformed, disfigured, and it requires a whole scale of plastic surgery. These procedures are very expensive procedures. It takes long periods of time, and the waiting lists are long.
Sometimes you have small children, babies really, who are abandoned, and they're taken in by various homes like Sanyu Babies Home, Welcome Babies Home in Jinja. There's quite a number of places that take them in. But those places don't have medical facilities, and so sometimes those kids get sick.
Baby Patricia is found from Mulago Hospital. So the people of Mulago Hospital called us and said there's a baby with us here without a mom. Can you come and take her and take care of her? So many children are suffering. They are sick. Some are ill because of no care.
The Hope Ward will mean for Patricia things like they come in for their checkups, they come in for tests, they come in for accommodation when they need it, and any specialist care that they'll need, and not just for 1 or 2 days, but for as long as they do need it.
It is estimated that about 120,000 Ugandan children could be HIV infected. The treatment is quite expensive, both to the healthcare system at Mulago and to the patient. But if we can get the Hope Ward up and running, some of these costs will definitely go down, because the inpatient costs on Mulago itself, the inpatient costs on the patient, because most times they have to buy their own supplies, they have to buy their own drugs, because the clinic is an outpatient clinic and does not routinely continue care outside our own clinic.